Hello, my name is Eric Christensen, CEO of the Heart of America Medical Center, and welcome to this week's CEO Update. So with this week, the big news around here has been the COVID pandemic. We've had a significant increase in COVID infections around our community and within our care center. Within our own walls within the facility, we are increasing with treatment of COVID and COVID patients. So people may be wondering, what is going on at Heart of America and how are you dealing with this COVID pandemic? Well, we've made a number of changes this week to deal with the COVID pandemic. First of all, we do have a COVID wing on the acute care side in the hospital. In that wing, we can take care of up to 10 COVID patients in that wing. We also have what we call the C wing or the COVID wing up in the care center, and we can take care of up to 12 COVID patients in that wing. So we do have two different wings within the hospital where we can do COVID cares, and we also have COVID patients at the Holland Estates in the basic care, and they have isolation. They are isolating the COVID patients in that area as well. So we've made a number of changes to help us deal with this COVID pandemic, as it's added quite a bit of burden upon our staff. Staff that are either becoming ill with COVID or exposed, unable to work. And so we're having to consolidate some of our resources to help care for all of our patients in our community, take care of our family and friends here in Rugby. So among those things that we've done is we've consolidated the clinic. So at the clinic now, we will be having the respiratory clinic. So that is still open. We have two providers there. So if you have needs that are coughs, fevers, sore throats, COVID type symptoms, even just body aches, diarrhea, things like that can be seen in the respiratory side of the clinic, and we can do COVID testing or other testing and be seen there. We also have an urgent care in the morning over in the clinic, and the urgent care is for non-urgent injuries and things like that you can do that aren't serious enough for the ER but can be seen in the urgent care. And of course, we still have the 24/7 ER for anybody's needs there. So the clinic has been downsized a little bit. We've taken a lot of the clinic nurses and they're working in various areas in our COVID units and helping out in COVID units. I have worked with our clinic manager, Dustin, and we've assigned a provider to acute care that will be on the acute care every day. We've also assigned a provider to our care center and long-term care that will be there every day, and a provider to our Holland Estates who will be there every day. So with this extra resource of providers in these areas, we can provide more immediate care and really hone in on the care for these COVID patients and make sure they're receiving the very best care that we can give here at Heart of America. I also wanted just to give some other updates to the community. Flu immunizations have been canceled for now in the clinic as far as a schedule, but you can still get your flu shots. You call into the clinic, they can still schedule you into some visits and work it through regular, like if you're going into the respiratory clinic, you can still get your flu shot if you're going into the respiratory clinic. So you can get your flu shot there if you schedule a visit. Also, the pharmacy will also do your flu shots and you can get your flu shots there. So please continue to seek to get your flu shots during this pandemic. We are not doing rapid testing to the public. The only time we do rapid tests is when we're admitting patients. Then we do rapid tests. So rapid tests are not available to the general public. So the general public, if they can get tested, we do have a drive-through testing over at the Holland Estates, and we have it set up in the garages there. We've expanded the hours from 9 to 1. So you call over to the hospital to get scheduled for, or over to the clinic to get scheduled for these drive-up testings. Of course, these are the PCR tests that get set up to the state. It takes about 48 hours to get your results. To get the drive-up testing, you need to be a patient who has been seen in the Johnson Clinic in the last year. And so you have to be an established patient, and they will do the drive-up testing over there. If you have not been an established patient and you're having symptoms, then you would go through the respiratory clinic. So just provide you some information there on how we do the drive-up testing. We do not do return to work COVID testing. So we're not available on that. That's based on the symptomatic, when you get rid of the symptoms and things like that through the quarantining. So we don't do return to work testing here at our facility. Also, if you are symptomatic and need to do other testing, you do need to quarantine until the tests come back. So if we test you and they say, well, how do I work? Can I go back to work? If you're having symptoms, you can't return to work until the tests come back and say you're negative. So until that time when it comes back, you have to still quarantine, and that usually, like I said, takes 48 hours. So that's just some updates of what's going on in here in the facility. I just want to send some thank yous out. First of all, to the Rugby JCs, thank you very much. We had Subway sandwiches provided by you, and I know we had some of our staff gown up and hand out the sandwiches, so that was really nice. I think it provided probably 3 or 4 meals for some of our staff, so thank you very much for those sandwiches. And I just want to send a thank you out to all of our staff. I have so many staff working so hard. They're going above and beyond. Just things I just could never imagine, how well they're working, the care they're providing, the things they're doing. I'm seeing amazing things throughout this facility, and I just thank you, and I cannot say enough. You've been such a blessing to your patients, to our families, and to our loved ones. We just thank you so much for all you're doing. We're hanging in here. Just ask that all of you just continue to keep us in your thoughts and prayers here at the facility, and just continue to just think of us. And so with all of that, just want to remind you that your health is our passion here at Heart of America. And Darcy is reminding me that I need to tell you and remind you, wear your masks. It's important. And just if you're out in the public, if you're in group settings, please put a mask on. That mask is the difference between an infection that could get to be very serious. So please wear your masks, social distance, wash your hands, just the general infection control things. It's a simple measure, but it really goes a long way in all that. So again, with all of that, just thank you to all of you again for all that you're doing to the community, for all the support, all the calls. It really warms our hearts. And thank you to all our staff. You're such a blessing. So God bless you all, and thank you.